A 7-year-old girl, recently hospitalized for abdominal surgery, now presents with increased respiratory effort and decreased activity levels. She has a history of mild asthma. Physical examination indicates decreased breath sounds on the left side and dullness to percussion in the same area. A chest X-ray confirms the presence of left-sided atelectasis. Which intervention is most appropriate for her immediate care? A. Start broad-spectrum antibiotics. B. Administer a bronchodilator. C. Implement chest physiotherapy and incentive spirometry. D. Immediate surgical intervention. The correct answer is C. Postoperative atelectasis, a common complication influenced by anesthesia and pain-induced shallow breathing. Typically does not necessitate antibiotics unless infection is suspected, or surgery unless there's a mechanical blockage. Management focuses on re-expanding the collapsed lung tissue, which can be effectively addressed with chest physiotherapy and incentive spirometry. These techniques help clear secretions and improve lung volume, addressing the root causes of postoperative atelectasis as described. Thank you for participating in this case review. Understanding how to effectively manage conditions like atelectasis is crucial in pediatric care, particularly in the postoperative setting. Join us next time for more insightful discussions.